I was having trouble sleeping.
My knees are pretty messed up. They're bone on bone.
I couldn't roll over comfortably. I couldn't get out of chairs.
The majority of what we do in orthopedics is non-surgical. We're in no hurry to take people to the operating room.
Joint replacement surgery is always, in my book, it's the last option. We can try injections, we can try oral medications, we can try watching your activities, all those sorts of things.
I was having knee pain, and so I came in to get cortisone shots.
Susie responded very well initially, but as we would expect through the course of injection therapy, she ultimately didn't respond any longer.
I came in thinking that I just needed my knees scoped.
I see a lot of different things during a regular day. I could see somebody with an injury and then also take care of somebody for just pain that came out of the blue.
I see pediatrics, I see geriatrics, I see diabetics, I see trauma. So I think my role is mobility.
I am really confident that the personal approach taken at Door County Medical Center is different than other places. The size of the hospital allows the nurses, aides, doctors, assistants to know you, and that's very different than any big institution.
Our therapists are involved, our social workers, our nurses, the whole team really takes care and takes charge.
One of the aspects that I like best about our program is that we really emphasize patient education. We are completely convinced that the best outcomes come from patients knowing exactly what's going to happen during their process here. And what we hear from patients is there weren't any surprises. And that's really the goal, that if patients are well prepared, they just simply do better.
From the front desk to the nurses, to the doctors, to the anesthesiologists.
The seamless coordination between your outpatient visits, your lab visits, your x-ray. You're not a number at Door County Hospital.
I think this is the goal of every orthopedics doctor, certainly, to have a patient come in and be able to restore them to a level of health that is where they were before. I mean, that's the holy grail. We love it when people come back in and they're able to function again, do what they want to do.
What I do love is the feedback I get from my patients when I can help them, and the appreciation I get from them. That's what probably keeps me going.
I couldn't have asked for a better team.
The patient is really the star athlete, so to speak, but we're coaches, we're managers, we're teammates.
But in the end, it's our goal that we've provided better than great patient care, and they're totally satisfied with their outcome.
As I call it, it's kind of our boutique hospital.
Door County Medical Center. Trusted team, close to home.